Welcome back. Thank you for watching the Prescribing Opioids for Chronic Pain Train the Trainer video series provided by ASTHO for the Federated States of Micronesia. You have watched the curriculum overview and group activity training videos to help you prepare to train other prescribers when responding to the growing misuse and abuse of prescription and illicit opioids. This video reviews frequently asked questions and where to go when you need to find the appropriate answers. We will also review the training pre- and post-assessments. The FSM Prescribing Opioids for Chronic Pain curriculum provides timely and relevant information for the treating chronic pain. Participants will have ample opportunities to engage in robust clinical conversations throughout the training, especially during small group breakout sessions. There are 4 frequently asked questions about prescribing opioids you may get from training participants. To follow along, turn to Questions and Wrap-Up Section 3 in the curriculum. ASTHO consulted with Dr. Jay Butler, Deputy Director of Infectious Diseases at the CDC, about frequently asked questions. Dr. Butler provides the appropriate responses to the 4 most frequently asked questions by prescribers. We will look at each of these questions and the suggested responses. For this training video, we will paraphrase Dr. Butler's answers. To see the complete responses, turn to page 20 in the curriculum to follow along. The first frequently asked question is about dosing. When and how do you taper? According to Dr. Butler, the 90 millimeter morphine milligram equivalent dosage is considered the threshold of concern. This question is an opportunity to view the difference between dependency and addiction, explaining that exposure and dose have some variability. He says, quote, "Even if patients exceed this threshold, it is critical to not fire patients or cut them off cold turkey. These patients may be dependent without being addicted." The second frequently asked question is heard from other practice clinicians that push back in treating chronic pain patients taking opioids. "But I don't want those patients in my office." Dr. Butler says, "Those patients are already there. They are just not telling you." Be a good doctor means taking care of everyone. For effective medical care, it is essential to know if someone is in recovery. Recovery is something else that providers rarely explore and patients rarely disclose. Yet Dr. Butler says, as providers, we prescribe opioids to them. Absent those critical conversations, the best outcome for the patient is to toss the meds and suffer the acute pain. In a worst-case scenario, they relapse and may be overdosed because they know what they took and are unaware what they have lost their opioid tolerance during recovery. The third frequently asked question is about behavior to reducing harm. Are you enabling? Dr. Butler explains how this question comes up, especially when talking about harm reduction. He provides a compelling comparison of patient behaviors. He says addiction makes people do things they would never normally do. Just as Alzheimer's makes people do things they would never normally do, framing addiction as a health condition involving the brain and acknowledging the differences. The fourth frequently asked question is an often heard concern. "But you are not in my subspecialty and you just don't understand my practice." Dr. Butler stresses how essential it is to respond to pushback when another provider fails to recognize that opioid misuse can occur to patients within any medical practice. Again, to view complete responses from Dr. Butler, check out the Frequently Asked Questions conversation with Dr. Jay Butler on page 20 of your training curriculum. Throughout the training, more questions will arise. Covering questions openly with the training group will help facilitate an enriching learning experience, and robust clinical dialogue can likely lead to an answer. As a training facilitator addresses any content-specific and clarifying questions at the time of the curriculum's learning instruction. If you receive a question that will require a longer response, wait until the final question and answer session. In Section 3, allow an additional 10 to 15 minutes during this question, certification, and wrap-up section to answer any lingering questions. If you have any content-specific training questions that need clarification before scheduling a training session, reach out to the ASTHO team. The ASTHO team is here to help you with any unanswered questions. Just email them at sbh@astho.org. Once you have your answer, be sure to follow up with the training participant. Before you conduct a training session, review the pre- and post-assessment evaluations. These can be found in Appendix L and M. You will instruct participants to complete the pre-assessment before diving into the curriculum on the 3 key pillars of the CDC guideline. Upon completion of the coursework in the 3 key pillars and following the Q&A session, ask participants to complete Appendix M, the post-assessment. The first section tests participant knowledge and comprehension of the material presented. The second section measures overall satisfaction with the training curriculum. It also surveys how and where participants plan to share the knowledge acquired during the training. Upon completion of the post-assessment, the participant is ready to receive an award of completion. Fill out and sign each award and give it to each participant before closing out the training session. This portion of the training wrap-up should help you answer frequently asked questions and show you how to complete the curriculum pre- and post-assessments. In the next trainer video, we will offer a final review of all Train the Trainer videos. It will tell you where to find training materials and resources to prepare you to lead training sessions focused on the prescription of opioids for chronic pain as part of the opioid prevention and response in FSM.